Are you suffering from tight hips, like a Piriformis Syndrome, like you feel like the nerve is irritating your sciatica if you're sitting too long and you feel like it's hard for you to open your hips out open? Hi, my name is Annie and welcome back to my channel, Annie Pilates Physical Therapist. And in this video, we'll be demonstrating how our piriformis affects our spine, our hips, and our pelvic floor, and why it's one of the deep hip external rotators that helps support your hip movement, hip external rotation. It helps you moving, you're walking, sit to stand, and it also affects your pelvic floor. It's one of the basin as well that if you don't strengthen, then it creates this dysfunction on your pelvic floor and your spine. So in this video, you will be needing a soft foam roller. I have a 3-inch foam roller. If you don't have a foam roller, this 3-inch diameter, then you can also use a roll towel or a pillow. If you're absolute beginners for gravity assisted, you might need an elastic band to strengthen your piriformis muscle and your glutes, and how the importance of your gluteal muscles that will help support your spine if you're having back pain, spasm, and stiffness, and your pelvic floor. And lastly, dumbbells to help you engage your pelvic floor muscles further, especially if you're pointing it up while you're lying on your back. So we'll begin the program by placing the elastic band around your thighs. Let's talk about a little bit about the piriformis and why it's so important. It originates on your sacrum area and it passes through like a nice sling diagonally all the way to your greater trochanter. It's a hip external rotator. It also supports your extension. It also supports your pelvic floor, as I said earlier, and it also, the sciatic nerve goes behind it, and sometimes 1% of you guys might genetically have a piriformis muscle where the sciatic nerve passes through it. So they always have this Piriformis Syndrome that we also call the fat wallet syndrome. So I recommend for men not to put their wallet on their back pocket, because when you sit too long with one-sided higher and compressing that muscle, then you get tight and weak and the nerve gets irritated. The sciatic nerve, which is the largest nerve of our body, and we don't want that. Then that nerve supplies all the way down to our foot, our leg, and the stability of your pelvis. So that's why we need to strengthen that area. Especially nowadays, we love to sit. If your job is a lot of desk job, working, and if you're driving a lot to and from work, truck drivers, those who are always sketching, drawing, if you don't strengthen your gluteal muscles, especially your piriformis, which is a stabilizer of our pelvis and our hip joint, then you're always gonna have some back pain, stiffness, as well as pelvic floor dysfunction, pain during intimacy, leakage that could happen. And that's why Kegling alone is not the answer. Kegels are great, but not the answer. You need to learn reverse Kegels, opening that rectum area, lowering that hammock sling structure that supports our pelvic floor. So let's begin the program. We're gonna start with placing the elastic band around your thighs, and we're gonna lie on your side first. So this is a pink band, so it's very light, and hold your very light dumbbells. If you don't have dumbbells, you can use bottled water. And we have more elastic bands. I'll wait for you guys to grab your stuff. And this soft foam roller, you can place this on the side of your hips to keep that neutral spine. So I'm placing it between my rib cage and my hip area, and I'm gonna keep my pelvis aligned, and this will help you slightly lean forward. A gentle support on your spine, because most of my patients with weak piriformis muscles and external rotators, they ended up leaning back as they lift the top knee. So with your knees bent 45 degrees, feet together, slightly lean forward, hold the dumbbells, one in front of you. So you slightly lean forward, keeping your core engaged as you take a deep breath through your nose, elbow level to your shoulder, so it's not out this way. Pull it closer. There you go. Hands forward, slightly lean forward, not leaning back. Take a deep breath through your nose. Exhale, lift the top knee, feet together. Exhale, squeeze your core in. Inhale down, exhale up. Hold it for 3, 2, 1. Inhale down, exhale up. Breathe out through your mouth. Breathe in and breathe out. Inhale. exhale. 2 more. Breathe out as you lift with your breath work. Last one. And now lift your hands up, pointing to the heavens. Inhale, exhale. From this position, we're going to extend your leg and tap your ankle, your dumbbell towards the side of your leg, and then all the way down, overhead reach. Breathe in, breathe out with your breath. Inhale as you reach through your nose, exhale through your mouth. Breathe in, breathe out. 2 more. Build those hip muscles. Last one. Well done. Now with your knees bent again, 45 degree, place your hands forward. Now we're going to do parallel clamp, which means you're lifting your knee and your foot up at the same time. Breathe out. Breathe in down through your nose, and then exhale as you breathe out. Inhale, exhale. 4 more. Breathe in, breathe out. 3, feel the burn. 2, and 1. The good thing about the foam roller, it will give you stability, because without this, you're going to feel a deeper burn for absolute beginners. Then you might have a hard time stabilizing. We're going to progress. Parallel clamp with a kick. So as you breathe in, breathe out. Lift to 90 degrees, not 90 degrees. Knee leveled with your foot down behind you, and then extend, kick. And then bend, and then down. So breathe in, breathe out, lift. All the way to extension, back to bend, and then down. Inhale, exhale, lift. Don't forget your breath. Feel the burn. 2 more. Kick, straight, not too high. Last one. Lift. Bend, down. Well done. Now we're going to place the foam roller on the side of your pelvis. If you're having a lot of pain, stop. So it's like a deep stretch on the insertion of your piriformis muscles. So we're targeting at the bottom part. If this is too hard, you have a hard foam roller, get soft pillows for support. If you can't handle it, you can just lie down like this. So this is helping you having a deep self-myofascial release. Okay, my friends. With the dumbbells down on the floor, because this is more challenging, but if you want to challenge, you can lift the dumbbells up with your hands up, and then exhale, clamp in this position. Breathe out. Inhale, exhale. Keep your core engaged. Try not to lean back. Slightly lean forward. Breathe in, breathe out. 4 more. Keep that dumbbell pointing up for a deeper stretch. 3. Slowly go back together. Don't plop your knee down as you breathe out. Last one. Well done. Now extend the top leg. Keep the stability. Overhead reach. Keep your elbow engaged. Try not to hyperextend your elbow. Slightly bend your elbow so you're really engaging your triceps muscles. As you breathe in, breathe out, lift. Tap the dumbbell towards the leg. Inhale down. Exhale, lift. Breathe in. Breathe out. 4 more. 3, 2, and 1. If you need a soft foam roller, comment foam right now, FOAM, and you can also get the link. And just to let you know, my Revive Pelvic Floor Health 8-week program challenge is now open. If you want to join, comment challenge or join, JOIN, and you can access the 8-week program starting today. So let's switch to the other side. Lie on your side, elbows down, grab the dumbbells in front of you. And we're going to start with clamshell. Knees stack up together, feet together, making sure your elbows stack up with your shoulder. Take a deep breath. Inhale, slightly lean forward. Exhale, top knee and hand up. Breathe out. Inhale, down slowly. Exhale up. Making sure the foam roller is on the side of between your rib cage and your hip. So it's in that nice muscle group to support your spine, keeping that neutral spine. 4 more. Elbow straight all the way down. Don't bend your elbow. Breathe out as you lift. 2 more. Control, try not to if you can't lift your knee up and you're leaning back, I'd rather you lift your knee up slightly higher, not too much. Last one. Well done. Now with your arms overhead, extend the top knee. As you breathe in, breathe out, lift and reach for your leg with the dumbbell. Breathe out. Inhale, overhead. Exhale, lift. Breathe in, overhead. As you lower your foot down, arms overhead. Exhale, lift. 2 more. Breathe in, breathe out. Last one. Inhale, exhale. Well done. Now back to stacking up your knee and feet together. And we're gonna do parallel, which means the knee and foot together as you lift. And down. Breathe in, breathe out. Inhale, down. Exhale, knee and foot up. 4 more. 3. Breathe out. Through your mouth. Inhale through your nose as you go down. 2. Last one. And 1. Well done. Now we're going to do with the kick. Parallel climb with the kick. Take a deep breath. Inhale, exhale, lift. And extend. Kick. Back to bend and down. Breathe in, breathe out. Lift. Parallel climb. Extend. Bend and down. 4 more. Take a deep breath. Exhale, lift. 3 more. 2 more. Feel the burn. So if this is your weaker side, you're going to feel much more difficulty lifting it. Last one. Well done. Now we're going to place your greater trochanter, the lower side of your pelvis, on the side where the muscle insert on your piriformis. If this is too challenging and painful, stop. It should be as tolerable. Now we're going to do clamshell in this position. Slightly soften your elbows. Try not to hyperextend your elbow. There you go. Engage those shoulder muscles and your arm muscles. Take a deep breath. Exhale, clam. Feet together, knees stack up together. Inhale, exhale, lift. Breathe in, breathe out. 4 more. 3. Feel the burn. 2. Exhale down. Now, with your leg extended, arms overhead on the top arm. As you inhale, exhale, lift. Tap your dumbbell towards the side of your leg as high as you can lift. Inhale, exhale, lift. 4 more. 3. 2. And 1. Well done. Now we're going to lie on your back. Place the foam rollers underneath your feet. And we're going to do some bridging with the challenge. This time, we're going to engage your external rotators. Grab both dumbbells now for a deeper core challenge. Feet together, and then separate your knees out. If this is too challenging, then knees together for those who are absolute beginners. Because when you open your knees out, you're engaging your piriformis muscles a little bit more. Hands up, forward, press up. Towards from your chest, press up to the heavens. Knees separated. Take a deep breath in the butterfly position. We're gonna do a bridge. Inhale, exhale, lift. And then slowly lift your arms overhead for a deeper core engagement. As you breathe in, breathe out, back to the center. Lift the dumbbells back, pointing to the heavens. And slowly roll down 1 vertebrae at a time while keeping your knees apart. As you inhale, expand your abdominal muscles for engagement of your core. Exhale, zip it up from your lower abs to your navel before you squeeze your glutes. Squeeze your piriformis muscles. Arms overhead as you exhale. Inhale, expand your belly again with your arms overhead. Exhale, zip it up and place your dumbbells to the heavens. Once you reach up here, you slowly roll down 1 vertebrae at a time. 4 more. Inhale, exhale, lift. Once you reach your hips up, arms overhead, inhale, exhale, back to the center, and slowly roll down one vertebrae at a time. 3 more. Arms overhead, inhale, exhale, back down. 2 more. Arms overhead, back center, slowly roll down. Last one. Slowly roll down one vertebrae at a time. Whew. Well done. Now with feet apart slightly, still keeping your feet on the foam roller, knees bent, and we're gonna slowly bridge up again. Hold that bridge as you breathe in, and then march. Lift your left leg in tabletop and switch to the other leg, and then roll down. Breathe in, lift, bridge. Strengthen your glutes. This will support your piriformis muscles. Exhale down. Inhale. Exhale, bridge. And march. Slowly lower your foot down. Try not to plop. Controlled movement. Always remember, contrology. Joseph Pilates said to control, not about speed. It's about control. 2 more. Last one. Inhale, exhale, bridge. And slowly roll down one vertebrae at a time. Well done. Now place the foam roller underneath your hips. And we're cooling down now. We did beautiful work targeting our piriformis. With your knees in figure 4, with the foam roller underneath your hips, let go of the dumbbells and hug your knees to your chest. So you're gonna have a deep stretch on your piriformis, and we're gonna extend the opposite leg for a deeper stretch. And we're gonna kick up and down 10 times. Dorsiflex your ankle as you go down, tippy toes as you reach down before extending your knee again. Dorsiflex and then bend with your breath. Inhale, exhale. 5 more. 3, 4, 3, 2, and 1. Well done. Now from this position, we're gonna rock side to side for a deep stretch. You can hold on to the foam roller so it won't slide off as you have that beautiful deep stretch on your piriformis. You can go all the way to the side if you want, as much as you can rotate your hips and your spine with your breath work. Last deep breath in. Now we switch to the other side. Now my right ankle over my left thigh. So my right ankle over my left thigh, and then hug your knee to your chest and extend the opposite leg. Inhale, exhale with the dorsiflex of your ankle before going down. Breathe in and breathe out. 10 times. 6 more. 5, 4, 3, 2, and 1. And now we're gonna hold this stretch and rock side to side as much as you can to rotate. You can hold on to the foam roller so it won't roll off for that beautiful deep stretch on your piriformis muscles. Rock it and rotate it against the soft foam roller. If you need a soft foam roller, comment foam right now, FOAM, and I'll send you the link to my limited edition foam rollers. And remove the elastic band, place it on the arch of your feet, and we're gonna stretch our hamstrings for a deep stretch. And ankle pumps, pump your ankles for a deeper stretch, and pull as much as you can as we end the program. And that's it. I'm hoping you enjoyed this piriformis strengthening program to help support your spine, your hip flexors, your glutes, hamstrings, and your core muscles. If you love this video, want to learn more about Pilates, yoga, and physical therapy, please subscribe to my channel, ring the bell so you won't miss anything. Like and share this video. Every like you're giving to my channel, you are supporting me. As I said, join my Revive Pelvic Floor Health Core Rehab link down below, or comment challenge or join so you can join my 8-week program. We have a lot of beautiful testimonies of my current students who graduated recently. I'm hoping you enjoyed my lovely program. If you have more time today, I have a Piriformis Syndrome program over here, step-by-step guide for absolute beginners if you find this routine too difficult on your tight piriformis with pain. And this video about the importance of your quadratus lumborum and why it's affecting your spinal posture and why you're having one-sided low back pain. Until next time, always remember, be safe, be well, and healthy you. Bye!